We are going to record this session so that you can take a second look at it, or you can share it with any of your colleagues you think may also be interested in this program. I am thrilled to have so many of you on the phone today, and hoping that among the 120 some California primary care residency programs, we'll have more than our quota of 40 interested programs in this project. I am the Assistant Executive Director at the California Academy of Family Physicians and also run our foundation. And this is a joint project of the two organizations. It is supported by the State of California Department of Healthcare Services under the work they're doing with SAMHSA and governmental agencies to look at issues of addiction, substance use disorders, and opioids, and also at the medication-assisted treatment for these issues. We would like to talk a little bit about the grant and grant opportunity, and then answer any questions you might have. You can ask them now, you can send them an email, you can shoot me a phone message, whatever. The overall goal of this project is to improve education, outreach, and treatment for patients with substance use disorder disease, including opioid use disorder, and focus on the medication-assisted treatment options. Our aim is to enhance training for primary care physicians while encouraging creative and innovative approaches to meeting program and community needs. Proposals should identify methods to improve or advance the standard of care for your patients, demonstrate how to best implement these, and evaluate the outcomes. One of the things to be of note in this project is that we are not going to tell you what to do, or what to teach your residents, or what type of activities to do. We want you to be creative and think about what will best meet your trainees, your residents, and your community's needs. So I think that's a little bit different than some grants you may have applied for in the past. The other new piece of this, to many of you probably, and I know that some of you have worked in a collaborative experience before, is that we're going to run this as a collaborative, basing it on work that we have done with the Institute for Healthcare Improvement, IHI, and their collaboratory model. We're going to support the 40 residency programs as you work through the 2019-2020 timeframe on your projects. We're going to be able to give the programs a cohort where you can learn from each other, you can problem solve with each other, you can have clinical and non-clinical learning for each other, with each other, and by experts that we bring to the table. And it enhances our accountability as a group to each other. The collaborative members will participate in face-to-face meetings in October to kick off this whole project, talk about what your programs are up to. We'll have some clinical updates around the particular issues, and you'll have some team times to work within your own team or regionally to look at what you all are doing and where you may share resource or information. And then we'll have a results meeting in September 2020 where everyone will actually share the results of their project. That'll be done in a poster fashion, and we'll produce the posters for you so that you will then have them to take with you to present elsewhere. We'll have 4 webinars during the time frame. Much of the content of those webinars becomes guided by the members of the collaborative and what's working for you, what's not. Maybe you need to talk about outcomes, maybe you need to talk about recruitment, those types of issues. And then just some regular check-in calls with our team here just to make sure that things are going according to plan. We will be launching an online platform that will be available for all of the programs involved in this place. You can upload pictures, you can upload documents, you can ask questions of each other. Our clinical advisory panel will be part of that so they can answer questions, collaborative questions, we can answer those types of things for you. The big number here, the financial support, this project will support $50,000 grants to California primary care residency programs. So we have $2 million to spend on this project, and we do need to spend it by the end of September of 2020. The attendance at those 2 face-to-face collaborative meetings that I talked about is supported outside of your $50,000 grant. So we support that. You don't need to budget for that in your grant. We have some staffing help for you. I will be working on this, and Conrad Amenta from our staff. And then Sarah Boyles-Muhek, who you will hear from during the summer grant collection process, is an intern with us this summer. She heads off to Davis in August to work on her MPH pre-medical school. We have a nice advisory panel, very much experts in this topic area. Dr. Tom Bent is on the board of our CAFP Foundation and is a past president and has been with his clinic in a collaborative such as this. Tony Breyer is an internal medicine physician with Sutter, has been largely engaged in health information technology and has been a practicing physician with Sutter. Carol Havens, family physician addiction medicine specialist, chairs our education committee and is a nationally known speaker around opioids and substance use. Tipu Khan is an associate director at our Ventura Family Medicine Program, also with specific work in opioids with pregnant patients, so brings that kind of OB scope. Michael Potter's a family physician at UCSF who is one of the leads for their research network, so will be helping us on the research side of this. And Lee Ralph is a practicing family physician in San Diego with a particular work in sports medicine and has done a lot of our pain work for us, so is involved in this. Those 6, and we may identify 2 others throughout the process, will be available for technical and clinical support for you. Next up, we have asked folks to go online to this Survey Gizmo link and complete an expression of interest. I think there are 4 questions. We ask your name, your program name, your specialty area, so family medicine, internal medicine, peds, or OB-GYN, and your name and contact information. If you fill out this expression of interest, you are not obligated to apply, but we're hoping that this will give us an estimate of the numbers of proposals we should expect, and that'll assist us in our scoring timeline and task list. So if you are interested, please go on and click on that link. And again, we won't hold you to an application, but it will give us a suggested number of folks who we think will be applying for this project. I now want to open this up to you all. What questions do you have? Sarah's actually on the call with us, and she's going to be recording and taking notes on the questions and answers. We'll turn that into an FAQ that we'll send out to all of you, again, with the recording of this call, and to your colleagues who may have questions after the call is over. So if you're not unmuted, feel free to unmute yourself, and let's hear your questions.
Shelley, I have a question. This is Ted O'Connell calling from Kaiser Napa Solano. We've actually been discussing this with some of our partner family medicine programs in Santa Rosa and San Jose, and wanted to ask if the CAFP would consider a multi-center grant application covering
Absolutely.
3 or 4.
Absolutely.
Great, thank you.
That made that easy, didn't it?
It sure did.
Our whole goal with this is to make it as easy as possible for the programs to apply and to be creative. You know, you'll notice that the application itself is 10 pages at the most. Doesn't have to be, but we want to make it simple for everyone.
Great,
Matt,
thank you.
Cumber. Matt, did you have a question? You were lit up on my screen for a minute. Other questions?
Resident Learning Center, it's half the construction. I can walk them through them.
This is Mark Simon. I have a question.
Hi, Mark. Yes, please.
To what degree can these funds be used for training and development of the faculty who will be teaching our residents?
You can use them creatively any way you want. So if you want to do some training of your faculty, that means your residents going forward will get the same training.
Thank
And
you.
it's hard to train residents when your faculty is not competent, confident, and skillful in this area. So feel free to do some faculty training. Does that answer your question?
Yes, thank you.
Great. Other questions?
You're going to walk past the construction and make a left walk them past it, okay? Okay, thank you, Dr. Hawkins. Your PowerPoint should already be there.
I hear some of you in the background not answering questions, but talking to someone in the room. If you have a question that you don't want to bring up live, you can also type it in the chat and we'll gather those questions in the chat.
Hi, this is Diane at Family Health Centers down in San Diego.
Hi, Diana.
If we have a curriculum that we've already developed and are working with, but we want to enhance it and do some more of the community involvement and stuff, is it all right to submit with something that's not in early development phase, but is a little bit farther along?
Absolutely.
Okay.
Yeah, this doesn't have to be just new work. It can be support work that's ongoing. It can be an enhancement to ongoing work. It can be an expansion of ongoing work.
Thank you.
You bet.
Hello, my name is Toussaint.
Hi, Toussaint.
And I just have a quick question. If our teams are planning on collaborating within the Sacramento area, and if so, is there just one grant awarded to one single program, or if there were two separate programs collaborating, would that be two grants awarded? Just curious.
If I were you, I would write it as 2 grants and reference each other. And then send me a cover letter so that I know that those 2 would be working together. That way you would have more money to work with.
Thank you.
Because we know that between now and the full proposal deadline is, mid-July, we know that getting letters of support from communities was tough. So talk about how you hope to work with them. And then part of your process between then and the October meeting would be kind of making those relationships happen.
Well, this is Diane. I'll ask another question. You talk about community engagement, since we're talking about community support and stuff, that's important a factor. Can you define for me a little bit of what sort of the extent you might mean as far as community engagement?
Diane, we don't have a percentage on it, but if you are going to engage in the community, I know I've talked to a couple of folks who actually want to work with like a student-run homeless clinic, which we call part of a community. So there would be that tie. If the students and residents are working within that clinic, that would be part of a community. We've had a group in a previous grant actually work with the Department of Public Health in their community. One group worked with the judges and law enforcement in their community, so that they started with that conversation about where needs were. They may not have worked together throughout the whole project, but they started with where those needs were so that they all kind of understood what they were addressing. Community is always nice. Your residents usually work in the communities. They'll go out and serve the communities. It's not required. It's just something you may want to think about. You won't be going down if you're just within your program.
All right.
I've had a question about who to bring if you're successful in receiving the grant and you're coming to the meeting, the face-to-face meeting. Again, we'll fund 1 or 2 people, probably 2 from each program, and that will depend greatly on your project. I know program directors. It's tough to get program directors out of the program, so it could be a designate, it could be a faculty member, it could be the faculty who's helping to sponsor this grant, it could be a chief resident, it could be a resident, it could be 2 residents, it could be If you're in the community, a community member coming with your resident. So as you're approved, as the grants are approved and the winners are selected, we'll have a quick call with each of you just to talk about that, to kind of help you figure out the best people to come to that meeting. We will also determine the site of that meeting based on who the recipients are. So if the vast majority of our recipients in Southern California, our meeting will be down there. Us Northerners are used to schlepping to LA. Other questions? Things I can answer before you start your writing.
My name is Tucson. I'm going to ask a second question. When I saw the link to the initial survey gizmo, once we send that in, will you guys send us a link to the application if we're accepted? Or is there another link to get to the, oh, you guys will send it to us with the survey gizmo. Okay, thank you.
Yeah, I can actually, we sent the grant application to everyone. The RFP, the request for proposal, was sent to everyone for whom we had an email address, and we used the ACGME database. If you didn't get it, shoot me an email or give me a shout right here in the chat, and I will make sure that I send you the RFP, because in it is the quick summary of what to put in your application.
Thank you kindly.
I have a question, Shelley.
Yes.
My name's Alicia. I'm with the UC Davis Family Medicine Program.
Hey, Alicia.
I'm curious. Hi, I'm looking over your the RFP, and I'm wondering, is this a lump sum $50,000 award, or does the application require a budget justification to that amount?
Well, you'll have to do a simple line item budget as to what you're going to spend the money on. I don't want hours of FTE times how many hours and how much money. So it's a very simple line item budget, very simple. Just kind of where you're going to spend the money. The grant will be paid out in 3 installments, and that is based mostly on when we get paid by the state. So we'll start with a $10,000 installment when you get to the first meeting, followed by 30, and followed by 30 or 35, and then followed by the final payment at the final meeting. Does that answer the question? Or
It does. Thank you very much. Nope, that's very helpful. Thank you.
Great. Thanks.
So Diane, again about the budget, you've got the thing here saying expenses for 2 members per grantee to attend these meetings will be covered by the grant. Does that mean one member per meeting, the September meeting and then the next October meeting? Or is that 2 per each of those meetings?
2 per each meeting. Yeah.
Oh, okay. All right. Yeah. Thank you.
Yeah, and I have that in my budget to cover so that you don't have to take it out of your 50.
Okay.
Would it be helpful to folks if we did a budget template for you?
Yes, please.
You got it.
Yes, definitely. Shelley, can you hear me?
Yep.
At institutions where there are grant people, on the simple line item budget, do we put in a line item for the grant department? It's indirect costs.
Depends. Well, we are going to have to know where this money will be paid to.
Okay. All right.
And after the awards are made, you'll have a very short 1-page letter of agreement with the CAFP Foundation, because this money will come from the foundation. So you'll have a very short letter of agreement from the foundation, and on that agreement you can put your payee information.
Perfect, thank you.
Hi there, this is Shannon McDermott from Kaiser Permanente in Santa Rosa. I have a couple of questions, just a quick question about the terms and conditions in section 12,
Yes.
where it mentions Pfizer in lines in the second paragraph and third paragraph.
Yeah, just pretend you didn't read that. That is a one line that missed a cut and paste. I've written about 12 of these in the last 6 weeks.
No problem. I just wanted to double check. Thank you.
Yeah, it's all state money, not Pfizer money.
Great, thanks.
You'd think with 8 of us reading this document, one of us would have caught that.
There's always something. I know. Thanks.
Mm-hmm.
This is Michelle from Loma Linda University Family Medicine.
Hi, Michelle.
Hi, and I have a question about indirect costs. Does this $50,000 pay indirect costs, or do they not pay for indirect costs?
Give me an example of indirect costs.
Well, the research department says some grants pay for indirect costs, so they will charge us a percentage, and some grants don't, and the ones that don't, they don't get indirect costs.
Then we'll say no.
Okay.
What we want is for your project and your program to get all the money.
Okay, thank you.
To do the work.
I would just suggest that anyone that has indirects add those into their indirect calculation as defined, that it will assist the grant.
Sure. Okay, fairly quiet now. Last opportunity, at least here. You can always shoot me an email there, and you can always give me a buzz as you're going through this process. And again, this is open to all primary care residencies, so we've extended the invitation to peds, general internal medicine, OB-GYN, and family medicine. We're hoping to have a mixture, given that there are significantly more family medicine programs than the others in the state. We imagine we will be heavily supporting family medicine programs. Okay, if we have no more questions, I'm going to give you an hour back in your day. I might take it back from you some other time during the year. We will turn all of your question and answers. Sarah's been gathering them. We've got the chat questions as well into kind of a FAQ, quick question and answer document. We will send that out with the link to this recording for you or for your colleagues to use. We will do a budget template and send that out to everyone. And anyone who's typed in their email address in the group chat, I'll make sure that you get a new version or a version of the RFP that we sent out. And again, we encourage everyone to do the expression of interest. And
Thank you, Kelly.
Yeah, if you have no more questions, I'm gonna let you all go. And look forward to seeing all of your proposals and meeting with you all in October.
Thanks, Shelley.
Thank you.
Thank you.